So if you're only missing one tooth, why a dental implant over a traditional bridge?
For a long time, our treatment option was for a missing single tooth was a dental bridge, and it's worked great. But some of the downfalls of a bridge are you have to prep down or reduce the adjacent teeth.
Like carve them down.
Like carve them down.
Side teeth. Okay.
Exactly. You know, another thing is you continually lose bone in that space where you're missing the tooth. You know, what a tooth does, it helps stimulate the bone around that, and the implant does that. But when you just have a bridge, there's nothing to stimulate the bone, so you constantly lose bone in that missing tooth area. And then as far as cleaning and flossing and brushing around that bridge, it can be complicated for a lot of people that have those, because you can't floss in between the teeth like you can your normal tooth.
How long does a bridge last?
A bridge lasts on average, you know, from 7 to 12 years for the average patient. Some can get a longer time out of that, but some get less time. You know, a lot of it depends on the care that the patient takes of the bridge. But like I was saying, it's hard to clean around, you know, and hard to floss around. And there's ways that we can teach people to do it, but you know, sometimes it's just difficult for patients to do it that way. Option number 2 is you can replace that tooth with a single dental implant. And the benefits of an implant is you place the implant in and it stimulates the bone around it. It's easier to clean. You can floss around it just like a regular tooth. And
it's permanent? And
it's permanent, exactly. And it's a permanent solution.
What about cost? You know, like what costs more?
You know, in the long run, it's less for a dental implant. With a bridge, oftentimes, you know, when it fails over that 7 to 12 year period, you're having to replace that again, so the cost just keeps reoccurring and replacing that bridge when it gets a cavity around it, or you need a root canal on one of the teeth that you had to prep down for doing the bridge. And an implant, you know, you just usually do it one time and it fixes your solution, and so the cost-wise, you know, is less in the long run.
It seems painful though.
You know, I'll tell you, we've done a lot of implants on patients, and I hardly ever have to give anyone anything more than some ibuprofen or Tylenol for a day or two, and they say there's not really any pain with the dental implant.
Is that right? And you do sedation in your practice. Are these people lightly sedated?
You know, some prefer sedation, some don't. It just depends on the anxiety of the patient, but we definitely can sedate patients with IV sedation or oral sedation, and you know, they don't remember anything about getting the implant placed.
So if you had a family member and they were just missing one tooth, would you do a dental implant or a bridge?
If I had a family member missing one tooth, I would do an implant in that space. Just, you know, long term, with the research, it lasts longer. It helps stimulate the bone. It's just a better option. It's easier to clean.
So why don't all your patients go for it? Do you think it's their fear, like they hear the word surgery, or they're worried about pain?
I think that's a big part of it. I think you made a great point there, Randy. I think they're afraid of the procedure, you know, just because they hear implant and it scares them, and they're afraid of having post-op sensitivity or pain. But you know, the great thing is we offer options such as sedation to overcome that fear. You know, so really, if that's their fear of an implant, you know, we can make it really comfortable for them and get rid of their concerns of
So
pain.
your message is, I mean, if you're missing one tooth or a few teeth, implants over a bridge or a partial.
Definitely. You know, I feel like implants is the best option. Bridge could be the second best, then a partial, you know, your third or last option.